Hi, my name is JD Kuzabur.
My name is Delaney Bartholomew.
Hemocare Services. If you're wondering, what is hemodialysis? Well, hemodialysis is a medical treatment used to filter your blood, basically when you have kidney failure.
Here are some images here on the screen to show you what kinds. From the abdominal and the arm, you can just see the difference in how it works.
My motivation to do this was my grandfather, who had recently passed away, and he had received hemodialysis.
My motivation is to honor my grandmother who passed away due to cancer. She also received treatments from hemodialysis.
As you can see, this is a picture of my grandfather and him receiving the hemodialysis. The objective of Hemocare Services is basically we're going to be providing hemodialysis at your home. But if you don't want it at your home, we have centers and we have an ambulance. Our center, you can go there and we basically take you there. And when you go to our center, you're going to see a lot of other people that are receiving hemodialysis that you can talk with and feel calm. If you go in our ambulance, we have TV and we have anything you want. We have even a little sound, so if you want to hear little calming music, we have it. We have the latest equipment, generation, and we also have a nephrologist who is going to keep in contact with our trained technician just to make sure that you're receiving the right dose. But don't worry, if you have any questions, we have a 24/7 helpline.
Here are some of the benefits of hemodialysis. We obviously want to look at the quality of life and the way that the patient can be comfortable. We always want to make sure that they are comfortable in their own home if they would prefer to do that, or if they are in the hospital, make sure they are as comfortable and stress-free as possible. I remember when my grandmother went through it, she was uncomfortable in the hospital before she passed away. So it's a good way to make sure that they can live a healthier and longer life.
To add on a little story, my grandmother receives hemodialysis. So basically, they don't have it right now, doing it at home. That's why we're bringing this service. So when my grandma has received hemodialysis, they had to come pick her up and take her to a place. We don't want for elder people having to go through that. We don't, because that's a very uncomfortable life, and more if they're older. Advantages. We have 3 different kinds of hemodialysis. Our first one is standard hemodialysis, which basically we do it 3 times a week, or you can do it on alternate days. It's your preference. And basically it takes 3 to 5 hours. Our second one is our short-term hemodialysis, which is provided 5 to 7 times in a week, and it takes up to 2 to 4 hours. And the most recommended one, the nocturnal one, which is done 3 to 6 times a week during the night while you sleep. And the reason why it's the most recommended one is because while you're asleep, you're calm and it works way better.
Some of the finances, it is between $1,000 and $7,500. Any insurance is taken. We know how hard it is to struggle with insurance, so we have as many as you need.
Just for you guys to see a little bit of a couple of pictures and so you have a little knowledge of how it works. Here's a guy, for example, we're doing it at home. Another lady, for example, she's doing it at home. She's reading her book, calm. So that's a very well done hemodialysis, because now she's gonna be, better. The treatment she's receiving is better. She's, for example, sleeping. This is the nocturnal one. This is a guy in one of our centers. There's another guy which is getting it done, and her daughter is there. So that's very important, because when you have the people you love, you feel better and you work through it harder. And the most important one that we've all been waiting for: how does our ambulance look like?
Here's our first image of our ambulance to kind of give you the idea of the perspective and the space that you would have.
And here you can see the ambulance and another angle. You can see here we have chairs and stuff, and we have a little window so that they can feel the breeze from outside.
To conclude this presentation, hemodialysis is all about being comfortable as well as living a healthier and longer life. We always want to make sure that it's important for the person to feel comfortable and also feel like they have enough resources to continue to live a healthy life. Even if something does happen, there's always a solution.
A little quick story. My grandfather went through that, and he was not happy having to be at the hospital. is not very happy. He wanted to be home with our family, be all together, you know, enjoy life with us. Because he was very bad, like position, like he wasn't gonna get out of it. So he wanted to spend his last days with us, but he couldn't. Just in case you guys need more information about us, you guys can look up at our website, you know, communicate with us, contact us.
We can't wait to help you guys.